to look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Good morning, good morning, good morning. How is everybody? My name is Dr. Ayo. I am your host for today on the 18th of November. It's so close to Christmas. I hope you've got your shopping at least planned. If not, got already. My wife has been shopping all year, so I think she does it so that I don't know how much things cost. But anyway, that's a side issue. Welcome to the CATHIP Health Hour, where we're gonna talk to you. Every week, we're talking about issues that affect the Black community, and we're doing our best to make sure that you have the information because informed is armed. So no matter what kind of week you have, weekend you're having, or week you've got next week, I want you to sit down, relax. We'll have a fantastic session for you today. I want to acknowledge our partners. So we have RAFA International Agency. We've got Croydon BME, we've got Enfield Caribbean Association, and the Royal Assembly Sheffield RCCG Church. We've got the Black Health Initiative, and obviously CARN, the Caribbean and African Health Network. Like I said, the aim is to do our best to improve outcomes for the Black community in the UK. So we have a fantastic session for you today. We have Dr. Oge Ilozue. Now, I've just got some of her accolades, which are really impressive. She's a senior lecturer, senior clinical advisor to the NHS London vaccination program. So we've not brought somebody small to you, somebody who's just been qualified for a couple of weeks. We've got somebody who is a GP for years and is advising the government and local authorities in London. So she's going to be talking to us today about the vaccination program and health issues as it pertains to winter. As doctors, we know that we get really busy around winter because there's lots of environmental things that can affect health. And this is going to be a fantastic session. I'm really looking forward to it. I'm going to be making notes. So without further ado, Dr. Oge, good morning. Take it away.
Good morning, and thank you so much for having me. So let me get my slide deck from the beginning. Hopefully you can see that okay. Is that big? Yeah, it's on screen share, lovely. I'm so excited to be here. I love this health hour. I think it's doing amazing work. I listen in myself from time to time, and so I really made the sacrifice to make sure I could be here again. I popped in a few weeks ago briefly, but was really excited to be invited back to just talk for a longer session on vaccinations and winter health. So a lot of the slides is about vaccinations, and I really wanted to also to a little bit about what we can do to keep ourselves well in the colder months. I always say that we are not used to these, well, we're used to these climates. We've been here many decades. I was born in London, of Nigerian background, but still struggle with the winter months. My name is Gay, as was said. I'm a GP partner and trainer, GP of over 11 years, working in London. And 2.5 years ago, started with NHS England as clinical advisor with their vaccination program. And it's London region. And I have to just acknowledge the assistance of the Legacy and Health Equity Partnership, which started after COVID, aiming to close that equity gap in vaccine screening and access to good health. One of my big quests and my core values and my big missions as a GP is to make sure that everybody has quality access to quality healthcare, everybody. But we know their gaps, we know the statistics, and it's beyond the vaccines, it's about our general health as well. So I was really keen to be in a position where I could inform, educate, because we can then make the informed decision when we have all the information. So thank you for having me back, and get going on the slides. So where we are now. So we're in winter. We're now November 18th, as we said. Christmas is only about 5 weeks away, which is insane to me. We're approaching the end of 2023, which is insane to me. But here we are, we're already thick in the autumn winter season. As GPs, we start vaccinating against flu in September, and COVID vaccination also started early on in September. So we're right in the mix of things. And these stats just show you the data so far. So far, in terms of flu, up to 39.7% of the eligible population in London have been vaccinated. Nationally, that statistic is 41%. So London, for whatever, lots of different reasons, always is behind the rest of the country. And there's lots of reasons for this, but we know London is also more diverse than other parts of the country as well. So it does mean that we have up to 3.2 million eligible people in London who haven't been vaccinated yet. In terms of COVID, just 31% of eligible people have been vaccinated so far, compared to 46.9% nationally. So again, 1.85 million people in London who can come and get the COVID vaccine so far haven't been vaccinated. And for COVID, the program will close on the 15th of December. So we're taking bookings up until the 14th of December. So my mission here is to say it's not too late to get it. If you want to, if you're still thinking about it, you can still book. And it's really easy to book it as well. So who is eligible? People may know this. We're not in the pandemic anymore. We all remember those years. And once the vaccine came available from December 2020, I gave my first vaccine in our vaccine hub. We were on a mission to vaccinate the most at risk, the oldest, the ones in care homes. And then we went down to vaccinate the entire population because we needed to get out of the pandemic. We're not in that situation now. So we're kind of doing similar to what we do with flu every year. We've done every year, in that we're offering it to the most at-risk population. So the eligible people are the people who are most at risk of becoming seriously unwell. And the main point of vaccination is to prevent serious illness and complications. So we know infectious diseases have been with us for, generation after generation. We've had vaccinations against lots of different infectious diseases. So flu and COVID are no different in that way. We want to prevent as much as possible, prevent the disease completely if we can, but we can't always do that all the time. But even if someone gets the disease after being vaccination, we know that that disease is a lot milder and is unlikely to lead to hospitalization and death, which we've seen before, and we see in the unvaccinated population. So those who are most at risk are being offered it this season. If you're over 65, pregnant women, care home residents, and they're people with certain health conditions. So if you have moderate or severe health disability, if you have chronic kidney disease, but very severe, needing dialysis, those types of conditions. If you're on chemotherapy and you have a depressed immune system, so you're more susceptible to infection, vaccination. All frontline health and care staff. So I'm a GP. I've had my vaccine. My whole practice staff, admin and clinical, have been offered the vaccine. So all frontline health and care staff and the care workers in homes or the carers that go out to people's homes have been offered it. Unpaid carers, if you're looking after someone that's vulnerable at home, you can. If you live with someone that's at high risk, so say you're living with someone living with cancer who's going through chemotherapy, you yourself are eligible for the vaccine to protect that person you're living with. So you can be invited by the NHS. You may have gotten several letters or several text messages. Where we were using every modality to try to get hold of everyone. So text, email, letter. But don't wait till you're invited. If you think you're eligible, contact your GP practice, or you can call 119, I believe it is, to ask for information, and they can help book you in and also ask any questions you may have. So it is important to get vaccinated as soon as you can. Like we said, we started the campaign back in September, but it's not too late. You have another few weeks to get that vaccine booked in, and it's to give yourself the best possible protection. So we know we still have December, we still have January, we still have February. In my knowledge, the snow usually comes about February. So we still got the colder months coming ahead of us. So even though we're in November now, it's not too late. So the JCVI, that's the Joint Committee for Vaccination and Immunization. So we don't do things in the UK not evidence-based. As healthcare professionals, everything we do is about being evidence-based. So we have this Joint Committee for Vaccination and Immunization that meets, and they look at all the data, and they also decide what it is, which groups that we should vaccinate, how we should vaccinate, when we should start vaccinating. So for instance, this week, they're meeting to decide what's going to happen for the spring campaign, which starts usually in March, April, May, June time. So they're thinking ahead, looking at the data we have already. So that committee advised us that for most people, you can have that flu and COVID vaccine at the same time. So we usually give one in each arm. But some people don't want it at the same time. That's completely fine. So for convenience, you can get it at the same appointment. It's safe to do that. But if you want it separately, that's fine as well. We're also offering the flu vaccines to children. So if your child is between 2 and 3, they can book their vaccine. It's us at the GP practice that's doing it. And it's a nasal spray that we give. School age children, so 4, 5, all the way up to, all the way through school, will be vaccinated by the school immunization program. So they should have been having their clinics in schools, and they should have been asking your consents for those. There are also community clinics being set up all around the country to help with that workload. So anyone that's under 18, that's in the highest of risks. So children, again, who may be undergoing chemo, children with certain will be also invited to receive their COVID-19 vaccination at specific hubs set up for them. So why do we need to be vaccinated? Why? And also every single year, we seem like we're doing it. I've had, there's up to 5 now vaccinations. So people are like, have you come again? And there's a lot of vaccine fatigue. So I thought it'd be useful to just talk about why we need vaccinations and just remind everyone. So if you remember at the peak of that first wave of the pandemic and those really scary days, compared to our white counterparts, so this is London data, but Black Londoners had 2.5 to 3 times higher the risk of dying from COVID-19. 2.5 to 3 times higher the risk of death from COVID-19. I know, looking at the TV, I know personally a really beloved colleague and mentor died very early on in the pandemic. He had come back from retirement and went back to the wards to work and died from COVID very early on, end of March 2020. So we know that people from Black, Asian, and minority ethnic backgrounds are more likely to be at that front line. We couldn't go to our converted offices in our attics and work from home as easily as maybe other groups and other workers. We were there. We're the porters, we're the bus drivers, we're the carers, we're the nurses, we're the doctors. We are going into work. We can't work from home fully. So it's even more important that we protect ourselves. So we know the data has shown us that there are gaps in COVID and flu protection amongst our community, which means that we may be more vulnerable to serious illness and more at risk of hospitalization from infection from COVID and flu. And there are also other variants that come about. So last winter, there's the 3 C's of vaccinations we talk about. Complacency, where we think, oh, it's not a big deal, it's fine. We also all need to be confident that this vaccine is safe and will do what it says it's supposed to do. And we also need to make sure it's convenient, so the vaccine is accessible, so affordable. We have the NHS, we're so blessed, where this vaccine is free for us, but we also need to make sure that the appointments are So we've been working really hard on all those three C's. But complacency is a big thing. We think flu is not a problem anymore. COVID's not an issue. We're past the pandemic. It's no longer a big deal. It's just a mild infection. But last winter, we still had 14,500 deaths from flu and over 50,000 people admitted to hospital. And that included 10,000 children. And over 140,000 people were sent into hospital with COVID-19. So the more we can prevent that and reduce those risks, the better. And vaccination is a massive, really powerful tool in our armory box of prevention strategies to try to bring those numbers down. We know those who are of older age, pregnant, or with certain health conditions. Catching flu can increase that risk of more complications. So it's not just about the flu itself, which can be quite bad, but it can lead to conditions like bronchitis, which is an inflammation of the lungs, pneumonia, where you get a secondary infection with bacteria of the lungs. And we know that there are people with long-term coexisting conditions. So those conditions can be worsened or exacerbated. So people can catch both viruses at the same time. And we're talking about flu and COVID here. There's my uncle's an ITU consultant. He's talking about RSV, respiratory sentinel virus, which we don't have a vaccine against. But if you're getting all these at the same time, it can make you very unwell. So let's protect against the ones we can protect against and keep ourselves generally well to try to prevent the rest as well. How vaccinations can help. So vaccines are our best protection. We have a tool of armory. Obviously, we use the draconian lockdown, which no one wants to see again, because we know that the negative impact on economy, on our children, on loneliness, all those things. So we don't want to have to shut away everyone in their houses again. Obviously, we should keep washing our hands and doing those good infection control measures. But vaccinations are our most powerful tool against flu and COVID-19. So getting flu and COVID-19 ahead of the winter are one of the most important things you can do to keep yourself and other people around you safe. So last year, so I talked about the ones that went into hospital, the ones that got flu, the ones that died. But we also know that we prevented about 25,000 hospitalizations in England alone. So we know that those who aren't vaccinated against COVID are up to 3 times more likely to be hospitalized, than those who are vaccinated. So we know that data, that's the evidence. It's really clear. So having your winter vaccines will reduce your risk of being seriously unwell. That's across the whole population. We know that from the evidence. If you have your winter vaccines, even if you do become unwell, they're more likely to be milder symptoms and you will recover quickly. That's what we've seen. And getting vaccinated helps protect our NHS. We know we need our NHS more than ever. And we all know the problems with the NHS, problems with every time I go on a talk like this, I'm asked about why can't I get an appointment with my GP? You know, there's a massive demand on the NHS. There's a massive demand on outpatient appointments. There's a massive waiting list for operations. So we know the pressures on the NHS. So if we can do things to prevent and ease that pressure so that our precious NHS is there when we really want it to be, all the more better. And vaccination, again, is a very powerful tool in our armory. So just a quick question about pregnancy. We know that flu and COVID-19 can be serious for those who are pregnant and affect mum and the baby. Pregnancy in itself is a relatively reduced suppressed condition. That's so that the mum can cultivate this growing baby. So we know that getting flu or COVID during pregnancy can increase the risk of admission to intensive care and can cause baby to be born too early or have a low birth weight. We know that stillbirth and death is a possibility. And again, we want to prevent those horrible complications. So if you're pregnant, there's also a higher risk of complications from flu and COVID, like bronchitis, like pneumonia. So the flu vaccination provides your baby with protection the first few months of life. So the wonderful thing is that you will form those antibodies in your body as mum, and then that goes across to baby in the placenta. So we know it protects baby in those few precious early months. It is safe to have flu and COVID at any stage of pregnancy and from the first few weeks up to your expected due date and if you're breastfeeding. So that's the data and that's the information about pregnancy and the vaccinations. Children, so flu can be horrible. We all are a little bit complacent about flu because it's been around for a long time, but it can be horrible in young children. And children under 5 can get really bad breathing problems and can be hospitalized really at high rates due to flu. So last year, 6,000 under 5s ended up in hospital because of flu. And altogether, 10,000 children were hospitalized with flu last year. The child flu vaccine reduces your child's chance of needing hospital care by about 2/3, but also helps that virus spread amongst vulnerable family and friends. So it helps protect the wider society as well. So your child can get the flu vaccine if they're age 2 or 3 on the 31st of August. So they can get that at their GP surgery. School age, so that's reception up to year 11, so all the way through the school ages. The child flu vaccine is a quick and painless nasal spray, and it's the best protection for children 2 to 17 years. We give injections for babies if they're eligible, 6 months to 2 years. So these are very vulnerable babies who may have a health condition. So we don't have a licensed nasal spray, but there's an injection, but that's a much smaller population. Parents can also opt for an injection that doesn't contain any pork or gelatin products as well. So if your child is of school age, they'll be vaccinated in school, and you'll be given the consent form to sign. All can book their flu and COVID vaccinations online at that website. If you type in COVID-19 vaccination to Google or any other web browser, it usually comes up. We're all being encouraged to download our NHS app and take better control of our health. So you can also book it in the vaccine as well. Through the NHS app on your phones or through your desktop. Flu vaccines can be booked through your GP practice or local pharmacy. So we have our wonderful community pharmacy colleagues who have also been very busy vaccinating. And there's lots of walk-in sites as well. I know I actually ended up getting my COVID vaccine in my local chemist, and I just walked in and they were able to vaccinate me straight away. So that was really convenient. Parents of 2 or 3-year-olds can book their vaccine through their GP practice, and school-age children will need to sign that consent form for their child to be vaccinated at school. Frontline health and social care workers should ask their employer how they can be vaccinated, but a lot of times the GP may not know your role. So if you just call your GP and ask them, and that's more convenient, or go to your community pharmacy and tell them that you work as a frontline health or social care worker, it's usually not an issue to get vaccinated there too. So that was the end of the slides. I also wanted to say a little bit about your, I'll stop sharing so we can get back and I can see everyone a bit better, and the chat too. I really wanted it to be an opportunity for people to ask questions as well. So winter health, general winter health and keeping well. I'm a GP, I'm really into prevention. More and more, we're looking after people with long-term conditions. There was some data out last week about how many people are living with a long-term condition. So I'm including things like your diabetes, blood pressure, kidney disease, asthma, COPD, heart disease. All these different things are long-term conditions, and they're manageable. A lot of times we have really good treatment, but we know that people get busy. A lot of times in our community, we're working how many jobs, try to keep ends meet, look after family back home, look after family here, look after older ones, look after younger ones. But prevention is really better than cure. This is something my mother has always taught me. So making sure you know the condition first, you're aware you have a condition, and then keeping up with your reviews. So that's if you're on regular medication, you should be having an annual review of what the medication is for, so you understand it. You should know if there are any blood tests. Usually we have monitoring blood tests to make sure that the medication is doing what it's supposed to do. So you need to be having that at least on an annual basis, sometimes more frequently if you need more monitoring. So it's just an encouragement. I know access is an issue, but as GPs, we really want to be able to do this stuff. And if you were to, a lot of GPs have an online consultation tool that you can write in and say, I haven't had a review recently. I'm really keen to review my medication or check that this is still working or get some up-to-date blood tests. And most places will facilitate that. I'm really keen that we understand how to prevent stuff as well. So keeping well generally. Are we getting our 5 a day fruit and vegetables? Some say we need even more, but let's start with that. Are we making sure we're eating the rainbow? Are we making sure we're going for walks every day? We don't all have to be in Zumba or aerobics class, but are we just going around the block? Even me, I got this watch thing that was driving me mad initially, but there is something about setting goals and checking, am I getting a certain number of steps a day? A cardiologist told me, oh, that 10,000 level is arbitrary, but you need to make sure if you're doing 4 to 5, that can still help prevent disease. That still makes a difference. So are we even doing that? And as I'm talking to you, I'm talking to myself, in that. So it's just a core for general winter health is eating as well as you can, keeping well hydrated with water, getting some walking, moving, getting up from that desk, walking around the block, even if it's that, no matter the weather, wrap up warm and get that fresh air, get that sunlight, through the clouds, get your steps in, and making sure that you are eating the rainbow as well and getting your annual checks in. Everyone over 40 should know their numbers, know your blood pressure, know what your cholesterol is, know what your weight is, know what your kidney function is. So there's an NHS health check that can give you that information. Keep an eye, our population as well, our Black community, what are your numbers in that blood pressure? Blood pressure can be a silent killer, it's a silent thing. It doesn't give you any side of any effects. You may not have any symptoms until it causes that big brain bleed or that big stroke. God forbid, we like to say, but God has given us the tools to arm ourselves with information. So what is your blood pressure? What are your numbers, the upper number and the lower number? And then there's things we can do from lifestyle, diet, movement, as well as diets, as well as medication that can really help control and prevent these big things. So that's the few words I wanted to say about generally keeping yourself well and overall health beyond vaccination. But really happy to answer any questions now. And thank you for listening.
Thank you so much, Dr. Oge. That was fantastic, really in depth, really detailed, really encompassing as well. There was so many things that you touched on, and I hope that everybody realized that you've got an expert speaking to you. And I know for myself, sometimes especially when COVID first started, the people that were trying to reassure me, I didn't trust them. So we have one of our own who's talking to us, just to check. That's okay. You've not been hoodwinked, right? They've not.
No, absolutely not. No, I was so keen because I know the fear. I saw the WhatsApp messages. The fear was there, and if that's what of course you'll be petrified. If that's all the information you had. So that's why I put myself and applied for the role of the clinical advisor, because I thought it was important for what we've learned in COVID is important for us to talk to ourselves. Sometimes it is needed. Yes, we live here, we're a minority here, but for us by us type thing, was really crucial for me. Hence why I'm here and I want to continue having those conversations because let's share with us what the concerns are. It is about building that trust. I know that I had to do that work in my care home with the care workers and it took time over time. And then they wanted me to vaccinate them. They didn't quite trust anyone. And so that's where the fear was deep. And we minimized that. But a lot of stuff is happening out there. So, so that's why more of us, and that's why this health hour is so powerful, because more of us are coming forward and saying we're here. Yes, we're part of the system in that we are doing NHS work, but we're also here because we care about everyone in our communities.
Absolutely. We'll probably come back and talk about vaccines specifically in a minute. We have some questions on the chat. So we have a question. I have a 4-year-old boy. Unfortunately, he's in nursery. So he wasn't given a flu vaccine at school. Neither was he given at the GP. I complained to school and was referred back to the GP after several calls and visits to the GP. I was told it can be done at a pharmacy near me. Please, I want to know how true this is and is it free?
Yes, it is tough because sometimes people fall between those cracks, of eligibility. So it can be really rough. Pharmacists generally don't vaccinate children. Some do, but generally they're mainly for adults. So what I would say in that condition, in that situation, he's a nursery, not reception. The GP should be able to pick up that gap. I mean, I know some GPs may say, no, they're not able to. The other option is to call 119 or to you can check with the pharmacist near you, because some of them are licensed for the children 5 to 11-year-olds or so, but 4-year-olds they may bulk a little bit at that. It's still very much the forte of the GP or the school age team. So he's 4 in September 8th. So he's not in reception yet. It's interesting. So reception should have really covered that. But there are a few kids that are a little bit out of sync and fall through those proverbial cracks. I will go back to the GP again. Check with your local pharmacist. There may be someone that is licensed to do it. But generally speaking, pharmacists don't do children in the same way as GP practices can. So try again with the GP. Apologies for the back and forth. Sometimes the NHS can be a bit like that, but it will be free. Yeah, you should not be charged for it. It should absolutely be free.
So we are streaming on multiple platforms. So we have a question from Facebook. I've read vaccines can cause certain developmental issues in children. How can I be confident that vaccines recommended for my child won't have any negative impact?
So yeah, I wanted to talk a little bit about the childhood immunization program, because we've seen in London, we've seen emergence of measles. As a GP, I've had to look up what does a measles rash look like, because we're seeing cases again. And that's because uptake for the MMR, measles, mumps, rubella vaccine has dipped because people are worried. Many years ago, this is when I was still in medical school, even before medical school, there was a report that MMR could cause autism. Since then, it has been largely debunked. And even the doctor that was in charge of that study was struck off the register because it was misinformation and it was abject lies, effectively. And there's been several studies after that that show there is no link of the vaccination with autism. We're seeing rising rates of autism. It's a condition we don't understand very much, and where it's more easily identifiable. So maybe that's another reason. So that is something that needs to be managed, but vaccinations are not linked to it. And there are other things like we did see with the COVID vaccine in the early stages. I'm not saying anything is not without side effects. So every tablet you'll take, even your paracetamol or your aspirin, everything has a side effect, but it's a balance between the benefits and the risk. So we always have to balance it. And for the whole population, we know that the benefits of vaccination far, far, far outstrip any risks, but there are risks. And the main side effects, you will get a sore arm. Some people are run down for a few days. Remember, these vaccines are stimulating your own immune system to make antibodies against these viruses. So it's not giving you the disease. It's just trying to stimulate your own, God-given, if you like, given what you have in your body. So you need a functioning immune system for the vaccinations to work. So you may feel a bit run down after you have the vaccines, but that usually settles after a few days. Very, very rarely, some people get major side effects. So there was a condition called GBS, Guillain-Barré syndrome. They don't know for sure if it's linked to the vaccines, but they saw it in usually younger people. So that's been looked at as well. There was with the AstraZeneca vaccine, remember you had those clots, abnormal clots that formed in weird places. And there were really tragically some deaths connected to that. But the numbers of that were minute compared to the millions of doses of vaccines we've given. And remember, COVID-19 itself caused horrible abnormal clots. So we have to always, as always, weigh up the risk benefits. So in terms of vaccines and child vaccines causing neurodevelopmental conditions, there's no evidence about that. We vaccinate, we've given millions and millions of doses. Think about these are the diseases we don't hear about: whooping cough, pertussis, which we're given to pregnant women because we want to make sure baby's protected. Diphtheria, what does that look like? Tetanus, polio. So I'm Nigerian, and I know that polio affected many people in particular. You see people who are paralyzed in wheelchairs, and we have a vaccine that can prevent that. Polio is a real condition that we never want to see again. I've never seen it in my clinical practice. I don't want to, but I've seen the effects of it in terms of, adults who are paralyzed because they were affected as children. So diphtheria, I've never seen. I don't want to see it. I haven't seen it because we have vaccination. Tetanus, we're all protected against. Hib B, meningitis, these are conditions I don't want to see. I worked in South Africa for some time and I saw a baby die of meningitis. I never want to see that in this, in my continuing professional career. We have a vaccine that can prevent that. So there's a wide range of vaccines we give to children. And it's really important that you check the red book of your child. We start it at 2 months, 3 months, 4 months, then again at 1 year, and then there's a preschool booster at 3 years, 4 months onwards. So it's really important that you check the Red Book if you have it. If you missed any doses, we can catch you up. So our practice nurses and our GP practices are on tapped treasure trove of information about this. So you can make appointments with practice nurses and go through if you're worried your child has missed any doses of any of those really crucial vaccinations, so they can get you caught up.
Thank you. I wanted to touch on a few things. So like Dr. Oge is talking about like the statistics, and I know that sometimes people can take it different ways. So one of the things that doctors have to learn to get used to is an uncertainty.
Yeah.
And because of the fact that it's an everyday thing for us, sometimes I think we just have to make sure that we're bringing people along. So for instance, if there's a 1 in a million, that means it's safe in general, because most people aren't going to be affected at it, but it still doesn't help the person who is the 1 in a million.
Yeah.
And I think sometimes we concentrate on the thing, and is it going to be me? Is it going to be me? And Dr. Oge talked about it. It's fear. A lot of this issue is because what I found interesting with the rhetoric around the COVID vaccine in the Black community, I was struck by, we've never talked about vaccines before ever. So we don't even have a basic understanding of how vaccines work. So COVID, everybody's scared of it, and we're projecting our fear onto this monster rather than necessarily dealing with the fact that, no, this is an issue because I'm scared. And like Dr. Oge said, there isn't anything you can do that is risk-free.
Exactly.
Sitting where you are right now, there's risk.
Exactly. You don't know. I mean, look at what's happening in the world at the moment. There's all sorts of things, So we just need to balance it every time. And our job is to give you the information, but we can't be scared off, because the stats are dire in terms of our community and how we're being affected by the diseases itself. So we want to try to prevent that as much as possible.
Absolutely. So we have another question in the chat. So how long does it take for vaccines to be developed? Isn't it 7 years? Please explain how you can know it's safe to take whilst pregnant. Where are the stats for this? This is from Martin.
Yeah, no, it's a really good question. So the main stats were real life, kind of, because COVID was a pandemic and we were seeing just horrible things. No one that works in ITU wants to see a heavily pregnant woman intubated, unwell, or having to try, no one wants to see that. So because we're in the pandemic and they were seeing this an increased number, there was a big impetus to say, listen, we need to, because initially when the COVID vaccines came out, pregnant women weren't included, because we're always extra careful when it comes to children, babies, pregnancy. We always want to do extra bit of work and checks and double check and triple check and all that. So pregnant women weren't even included, and there were quite some groups that were quite upset about that, because we could see, real life, it was happening in real, because it was a pandemic, everything was extrapolated and magnified and happening double the time, triple the time that it would normally happen. So we could see that it was affecting pregnant women more. And it was in America that they started vaccinating pregnant women early. So we were able to use the data from real life, situation. There was big studies done there where they tracked women who were given the vaccine all the way through and afterwards. And they're still following those women up and those babies up as well to make sure. And it was shown it was safe. So because there was an urgency and a need, and everyone wants to stop seeing what we were seeing, our frontline hospital people were the ones seeing and looking after these women. We needed to do something sooner rather than later. So they did the study. They showed it was safe in that cohort. So that's why they rolled it out. And we're now at a phase where we've seen lots of data across the world, but it started, our UK, they used the US data to show that it was safe in pregnancy, and that's why we started vaccinating them. Now we've been vaccinating and tracking and looking and observing, and we know it's safe now. But that information, we still need to make sure we're reporting it. Yellow card, people say it's underreported, but it's still important to report. They look for patterns. And that's why, for instance, the AstraZeneca one, we readjusted. It was withdrawn at one point for under 40-year-olds, It's now not really available. It's in some rare occasions you can get it, but we're using other vaccines now. So we're always readapting accordingly. And if people were waiting to check, is it really safe? We're now 3 years on, good 3 years. So we have real-term data as well as the research data. And just to talk about the research, does it take 7 years to develop a vaccine? What happened with COVID is that there was a lot of things happening at the same time. And it just shows you what happens. Where there's a will, there's a way, When people want something to happen, they make it happen. So there was political will, there was a financial will, the money that was unfortunately taken from other trials put into the COVID vaccine trials. We had 3 or 4 vaccines that emerged at the end, but there were how many companies working on it? There was shared information and collaboration between different groups. There was work already been done on mRNA vaccines, with the Ebola vaccine and with cancer work. So it wasn't completely new technology, but it was then applied. The COVID-19 virus, makeup and structure was shared by the Chinese. So everything happened quicker because of that collaboration, because the funding was put there, and there was a will, there was a real kind of united, we need a solution to this horrible situation we're in terms of the fact we're in a pandemic. So that's why things felt that it was accelerated and things did happen quicker than they normally would.
It's amazing what can happen if everybody puts their mind together and works.
Absolutely.
One will. Okay, so we have another question. Please confirm that there isn't a COVID passport for this year's vaccination and that it's not recorded on your COVID files.
Yeah, so there used to be this COVID vax, because remember when we're traveling, you couldn't travel. That was a real incentive for some people. You needed that passport that you had to download, and it had to be in dates and with the QR code. And some countries weren't letting you in without that. Now, if you go on your NHS app, I just went on my app the other day, and it will show you all the vaccines you've had. It should give you that, so you can screenshot that if you need to. But COVID passport in itself is not needed or available. You mentioned going to America, I think. So it should be there on your NHS app. And if you can't find your record of your vaccine, you can ask your GP to make sure you have full access in terms of all your records, or your GP should be able to print that off, because it should be on your GP records, and then you can take that off as evidence you've had your vaccine if you need it. But the COVID passport was very much in the height of the pandemic a requirement for travel, and it's not so now
anymore
for most. Yeah.
Fantastic. So someone reiterated the question about the 7 years, but I think we've addressed that. What is the minimum age to take the COVID and flu vaccine?
So the minimum age is 6 months, so we can vaccinate babies from 6 months of age. Their special, usually is done by one of the doctors. 6 months baby that needs a COVID or flu vaccine will probably have a healthcare condition that means they're under hospital treatment. So that may be done there. But in terms of GP and the general campaign, 2 and 3-year-olds are done in the GP surgery. Usually 4. I know we had a comment about a 4-year-old that was in nursery, not reception, but 4 in reception all the way up to year 11 should be done in school, or they may be invited to a community clinic. If you are a child and you have a health condition like asthma, you can be done at your GP surgery as well. So there may be a possibility to get it done there. And then anyone over 18 with a healthcare condition or a carer or a healthcare worker can get done at a community pharmacist, at their GP practice, and there's a lot of walk-in sites. COVID this year, mainly everyone over 65, and that's the same with flu. And with COVID, it's those with the healthcare conditions. Healthcare conditions are slightly narrower than for flu. So flu, there's more. Like if you're asthmatic, you're eligible for flu. But if you're asthmatic and you're mild and moderately controlled, you're not on steroids or any major immunosuppressant medication, you're not eligible for COVID. So it's not exactly the same cohorts. But if you're not sure, check with your healthcare professional.
Fantastic. And I think, I wanted to reiterate the issue about fear. I think one of the things that, this is just where my head is at these days, one of the things that when there's an issue, what I speak to my kids about is when you feel icky on the inside, often what happens is that we push out and we look for a problem somewhere else, and we don't do the work of addressing, why do I not feel so good on the inside? If there's an issue with fear, let's deal with that head on. Let's have a conversation with ourselves, with our family, with our therapist, with our GP, and address the fear. Because if I am going to every situation with fear, there's data to suggest that positive mental attitude or mental attitude will affect my outcome for things like surgery. So the surgeon is the same, but my disposition to my treatment and my healthcare provider will influence my likelihood of getting like complications and stuff. So it's a big issue. I'm a big believer in the fact that we are body, soul, and spirit, and each one affects each other. So I'm just wanting to encourage everybody, specifically when it comes to COVID and vaccines and health. If there's fear, let's deal with that head on, because I think it will have an impact on everything else that we talk about.
Yeah.
As a doctor, it's
Yeah.
very telling to me that I give medications to people almost every day, but it's not everybody who asks me about side effects. That
Yeah.
tells me something about the person who's asking. And again, it's not an
Yeah.
application. I'm just saying, I think this is something to look into, you know,
Mm.
figure.
No, I totally get it. I think that those work. I'm thinking actually, what is making me think like this, or what has led to me? We're bombarded with so much information. We're in the information age, but are we in the wisdom age? It's the
Mm,
application of that information to make sure that we're okay. But we're bombarded from left and right. That it does cause like a weird dissonance in our minds. So we have an unease about something, but what's that based on? And actually, to then say no to something that will actually may save you in the long run,
mm,
is not the way forward. It is about delving down actually, what is this about, and how can I then make sure I increase confidence in the process? What do I need to do? What information? Who do I need to speak to? And I think one thing this whole process has taught me, the importance of trusted relationships. So whether it is your GP or your nurse, but because of access and the demand, that might be more difficult. So we have community champions, amazing people that volunteered, that came, that helped to get shopping, helped to get medication, helped to take people to appointments, and then are being trained up or educated about things that can then pass the information to their peers, because that peer-to-peer education is so crucial. But who do you go to to check, to sense check, and to figure things out? If you're left to just, I always have to bounce stuff up, my siblings or family members or trusted colleagues. So we all need people that we trust that will do that work, to be able to bounce off and really do the research. People say they've done their research, but if you're reading the same feed on your social media, remember, you click on something, all of a sudden it shows you the same thing 10 different ways, but the same thing. So we need to retrain ourselves to start doing the critical thinking. I was taught that in my first degree, when I did my dissertation. Look for the other alternative viewpoints and then weigh up accordingly.
absolutely. And last thing I want to say about this is that let's remember that Google is a search engine. It's not a research engine.
Yeah.
There's a way to get information, and we have to make sure it's trusted sites. So, right. So another question. Thank you for your overview. I'm really keen to hear about winter protection, especially for older people and those with respiratory problems. You mentioned nutrition, but can you talk about recommended supplements that can help our immune system?
Yeah. So I think, as a GP, I have not done enough work on nutrition. I'm even learning this myself, because I'm finding the post-40 life is not what it used to be in terms of some of the aches and pains and the things I got away with that I can't get away with anymore. So yeah, definitely nutrition for me is about that rainbow. And I'm talking to myself as I'm talking to you. Supplements. So we're Black. Like I said, are we meant to be in this country with the no sunlight? Most of the population, whether dark skinned or light skinned, are vitamin D deficient. So every time I do a blood test, 8 times out of 10, it comes back low. So there's supplements you can get at your chemist that will then keep those levels maintained. If you're having lots of very achy bones, if you're very tired, you may need to go and get the blood test to make sure it's not very, very low, because you may need the higher dose. So if I do a blood test and show that it's very low, I'm given 20,000 units that I want people to take, for like 10, 12 weeks. Then you can go on to the maintenance dose of 1,000 international units a day. That's 25 mcg that you can get anywhere. And I'd say all of us need to be at least on that every winter, if not all year round. And we don't get as much vitamin D in our food. You can get a bit in mushrooms and some oily fish and things, but we don't get enough in our food, and there's definitely not enough sunlight in this country. So, and even then, we need to be using the sun. We're all talking about our skincare and SPF 50 and how we still need sun protection, even as Black people. So vitamin D supplements is key. And I would say all of us should be probably on that year round, because we don't have enough. Calcium as well. You can get calcium in green leafy vegetables, as well as your yogurt, your cheese, your milk. So calcium is important, but we get enough of that in diet. So we don't need calcium supplements as much, unless you're diagnosed with a condition like osteoporosis or osteopenia, which you know about. what was the other question about older people? So the main thing, yeah, vitamin D is the main one I recommend. Some people talk about B vitamins, iron, but for me, it's about eating the rainbow and food first. Any dietitian will say food first. Get your nutrition from food, and then if you find that there are deficiencies in things, then you can supplement accordingly. But widespread, most of the multivitamins I don't think have enough. So there's not enough vitamin D in a multivitamin, for instance. So vitamin D is the key one for us, I would say, to focus
Yeah.
on taking, and that can help. It helps with our, we know it helps with immunity. Remember, it sold out during the pandemic, so people may forget that, but that was actually good information that went out there, that we were giving vitamin D to care home residents because, of course, they're mainly stuck indoors. So that was actually a really good piece of general information that may have now gotten forgotten. So I'd really recommend vitamin D supplements for everyone, actually.
Fantastic. And I think I want to really piggyback on what you were saying. I think especially in the West, the kind of models of care that we are exposed to or we talk about, sometimes there's a desire or a impetus to reach for a pill, you know,
Mm.
and there are other things that would help you. But for me, this is my perception. This is not a comment on the person who said this. Sometimes it's an issue about taking responsibility. So because if I so like Dr. Oge, you will have seen as somebody who has severe lung problems but doesn't want to stop smoking.
Mm.
Like so, and they want me to give you a pill
Yeah.
for you to feel better. But the thing that you could do to make yourself feel better is stop smoking. Literally everything else I do is less good than that. So, and I think for me the biggest message, as we've talked about a few times in this talk, is taking responsibility for our own health, know the numbers, and I think there's lots of information out there. There are NHS apps and websites that we can go and say, okay, well, what is a good diet? We know that some of this thing is geared to people who don't look like us from a diet point of view. Because like the foods that we eat aren't necessarily represented in Weight Watchers and other such things like that. However, the information is out there as long as we're willing to take the impetus to say, okay, well, this is my life, this is my health. What can I do to put myself forward? So I think if piggyback on that, I think making sure that we have a great diet is really important.
Yeah.
And human nature is such that we would rather do something hard periodically than do something relatively small every day. So maybe I'm going to not have that dessert. I'm going to have that liter or two of water every day. I'm going to add green leafy veg, fresh veg to my meal. I'm going to go out for that meal. And you know what? So Dr. Oge talked about being over 40. So a few of my friends, we've challenged ourselves to do 100 press ups a day.
Oh.
Oh, my sister. So, but the thing is that one of the big things I think can help in terms of this winter pressures is community.
Mm.
So talking to people and saying, this is the thing that I'm struggling with. Can we walk together? So there's about 20 or 30 people on this WhatsApp group, but the fact that we all are accountable to each other actually has increased compliance.
Yeah.
So if there's an issue, if the issue is blood pressure or diabetes or COPD or whatever, there are groups around that you can say, guys, can you walk with me? Not just physically, metaphorically. Let's go down this road together. I'm going to go for a 5-minute walk today, and I'm going to let you know that I've done it for the sake of accountability. I think it's really, really important. I think community solves so many problems.
It's crucial. Totally agree with that.
So we've got some other comments. I'm concerned and hesitant about the vaccines and have not had any flu or COVID vaccines. I said I would wait and watch to see if there are any side effects. What research is taking place to follow up on those that have taken the COVID vaccine? And is there anything out there to reassure those who are hesitant if there is, hesitant? If there is research, have Black people been involved?
Excellent question. It's a really good question, and thank you for asking it. So You're watching and waiting, absolutely fine, to see if there's side effects. And I think lots of people have done that. And the research is following up people who have taken the vaccine. So I know colleagues that were involved in the trials, in the summer of 2020, and they've been followed up to check, about the vaccine. They've been vaccinated. They've had several vaccines by now. So there's ongoing. You usually have long-term data with a lot of these trials where they do follow up to make sure there are no long-term effects. And that information is still going on. So we're not 5, 10, 15 years in yet, but we'll definitely have that data, and that work is happening. If there's research, have Black people been involved? Brilliant question. Should we ask ourselves that? Because I know I'm from a medical family, and my sister said she was about to sign up for one of these COVID vaccine. My mom's like, why would you do that? And this is medics saying, we don't want to be guinea pigs, yet we say that the research doesn't apply to us. So there's a big drive now. I was just involved in there was a conference a few weeks ago, and we had an Oxford research group. They are looking for us, but we don't tend to volunteer. It's made on volunteer basis. They're not going to force anybody. You can't, ethically, you can't force anyone to take part in trials. It's on a voluntary basis. Then they see if you're suitable and eligible, and then get you involved. So it's for us to step up and say, yes, we will put ourselves forward. Usually they're looking for fit, healthy volunteers. If you have certain conditions, they may offer you a trial. So the clarion call is for us to get involved, but there have been Black people involved. A lot of the COVID vaccine research was done in South Africa, and that involved some of the Black population there too. So we have Black researchers, Black scientists involved. I've been on talks I'm saying that throughout the last 2.5 years, some brilliant people behind the data, behind the research. So research is ongoing, but it is a challenge to us to get involved, and maybe that's something I know Khan is really keen on things like that as well, and making it more visible. Because I think one thing COVID has done is brought to the surface what happens behind these the scientific. We know there's science, we know there's research, we know there's evidence-based, but what does that actually mean? So maybe we can break it down and make it more transparent, the process of how medicines are approved, researched and approved, the process of research. What is research? What's a study, a proper randomized controlled study that is the big gold standard in terms of which we use evidence to say this thing works and this thing doesn't. So much research is happening all the time, but it's something that we need to do actually as health professionals, is make it more obvious, and then bring forward the opportunities to get involved, because there is a lot of opportunities to get involved in research, but I think it's been somewhat hidden from our population. So yes, there is research happening. Yes, we need more of our people involved in that research, but it's for us to also step forward, and it's for us to make it more visible and transparent how it works, and make those opportunities for us to get more involved.
Fantastic. We've got a question from Yabo Fashion. I want clarity on whether one who is under 65 is not eligible for COVID vaccine if the person does have some medical conditions. So sure. I've just put in the chat, actually, there's a website, NHS website, says who is eligible for the COVID booster. So I think, because I think we've kind of addressed it in the talk, but that's a
great question.
A resource that everybody can have a look at. It's in the chat. So have a look at it on the link, and it hopefully should answer your question. I think your GP might be another port of call if there is any sort of ambiguity about that.
Yeah, or 119. I think you can call 119, and they will also help with COVID vaccine information if you're not sure.
Okay. Another question. Would I still need vitamin D if I have sarcoidosis?
So interesting question. So there are some conditions where they advise being cautious. So you hopefully be on the specialist, or you can ask your GP to check your levels of vitamin D and calcium as well, in particular, because they do work together in the body. So as long as you're not, it's very hard to get vitamin D toxicity, so to overdose. So it's quite difficult to do that. But if you're worried, I'd say get a check your levels, and then you can supplement accordingly if you need to.
Fantastic. So another question. I've heard that low vitamin D levels can lead to heart problems. Can you add to this? If there is any truth in this, can this partially explain our high rates of heart disease?
Yeah, it's a good question. I think vitamin D has been linked to so many things. immune problems, different conditions. So we know that supplementing it is not harmful. It's very hard, like I said, to get toxic levels, and we know it can improve many things. So I'd say if someone's worried about heart problems, they should make sure they're getting those checks accordingly. Lots of different things can lead to heart problems, so it's a multifaceted contribution pot. But vitamin D is easily fixable. I love it when, I see it, because I'm like, there's something we can do that does work and is so easy and low intervention. So I'd say if someone's worried, can it possibly explain our high rates? I think so many things contribute to the high rates. People not checking their blood pressure, people not getting those regular checks, people working themselves to the ground, the stress, inflammation from bad diet, inflammation from disease and not looking after ourselves. So there's multifaceted, but vitamin D is a relatively easy fix. So like I said, we should all be on that 25 mcg or 1,000 international units a day, definitely in the winter months. And if you're worried there's more going on, then ask for that blood test. We don't like to repeat the blood test because there's no real need to, but if you're very worried that you're very tired or you may be very low, then you can get a one-off blood test at your GP.
Absolutely. And I love the fact that we're becoming more a more informed community. Because I think informed is armed, and
yes,
that really gives us confidence in our decisions. And one of the ways that Khan is helping with that is that Khan has research leads.
Yeah,
So
I've just seen.
Some of these questions are nuanced and specific, and I want everybody to know that you can email Khan directly to ask some of your questions. So it's research@khan.org.uk. That's RESEARCH @CAHN.org.uk, because I think getting the information is really, really key. Knowing is better than not knowing.
Absolutely.
We've got a comment from Pastor Chinyere. Accepting health facts is an ongoing concern in our community. Some health hour topics attract more than 180 participants, but because today's topic is on vaccinations and ill health prevention, some of our people are not interested. This is worrying. I agree.
I do agree. And I think that's why for us, and that's why I think platforms like this are so crucial, because sometimes we need to talk to ourselves, because sometimes the problem may be with us. So we need to be like, come on now, and there's a way we could talk to ourselves, that we can talk to ourselves, and then we have those conversations about advocacy and making sure we're at the right levels externally. But I think that's why these platforms and these groups and the town hall meetings and the small community groups and the peer teaching is so crucial, because sometimes it could be like, oh, you want this, but you're not willing to do this. You can't have it both ways, and then you can't say the system's against you when you're not willing to learn when the information's been put out there. But then I love the fact that this is available on YouTube. People can look back at different times, and sometimes people don't want to be even seen coming to something like this, but the information is there, and you can share that link. Someone posted it in the chat, share it with people. When they're ready, they can then tap in and get the information.
I'm sure, Pastor, you can relate to the situation at church when you say God is going to bless you, amen. And when you say, God wants to make sure, God wants to help you overcome sin, the amen is maybe less energetic. On a related note, I was at a business summit the other day, and it was for businesses owned by Black and ethnic minority. And the take-home message from me is exactly what you were saying. Sometimes when we're saying the system is against us, actually what we haven't done is ask the question, what is the thing I need to do? And if I come, if let's say as a business proposal, if I make a pitch but I don't know what's required, that's not them discriminating against me because I've been below standard. So similarly with health, there's lots of stuff that is for you. There's lots of information out there. There are lots of people that are fighting to make sure that you get the information and you have access. But we have to take responsibility. This is your life. This is our life. No matter what Dr. Oge does, what Dr. Ayo does, what your GP does, the person that's going to have to deal with the consequences of those things is me, is you. So I think we have to really, really, really take responsibility for it. Are there any other questions? No, so I think we've exhausted this topic. It's been really, really great talking to you, Dr. Oge. Is there, I'm very big on a one takeaway. Is there one thing that you can say that you want everybody to say, I want you to do this with regards to this topic. Well, let's do one thing for COVID specifically, and one thing in terms of winter health.
Okay. So one thing for COVID is check if you're eligible and really look at some of the NHS information out there. A link was posted about who's eligible and the benefits of vaccination, because I think the benefits far, far outweigh the risks, and we need to protect ourselves so that we can be as healthy as possible to do all the other work we need to do. So, yeah.
Fantastic. And winter health?
And winter health is really, so with winter health, I would say, have you got that annual check-in, especially if you have a long-term condition? If you don't, have you gotten your checks? Do you know your numbers? You know, your blood pressure, your BMI, your cholesterol level, your kidney function. So get those checks and make sure you are eating the rainbow and at least taking a walk and drinking that water every day, and vitamin D. At least if you do that, we have gotten somewhere.
Fantastic. So thank you so much, Dr. Gay. It's been great having you and great talking to you. You are a great resource to our community. So thank you for your time.
Thank you for having me.
Thank you everybody for attending. We wouldn't have these we wouldn't be able to have these health hours if not for you attending. It would just be me and Dr. Ogie talking to ourselves. So thank you for engaging. Thank you for the questions. I hope it's been you've realized all the value that you've gotten. So I'm going to hand over to Percy now, who's going to take the session out.
All right. Thank you so much, Dr. Ayu and Dr. Ogie, for that. That was really brilliant, really. I mean, lots of learning through that. I think we covered so many things, from awareness to stuff around history as well, really looking at vaccine. There were lots of things covered, and then the answers to the questions were brilliant as well. So just to say massive thanks to you both. We know how busy your schedules are and all that. So taking time out to come and speak to us really and provide all this information is really, really helpful. So just say massive thanks. And we hope we can see your faces very soon as well, really. So thank you so much. And still just to extend thanks as well to those who have joined us on the call today, really. So for everyone that's joined in, we're really grateful you've been able to keep some hours of your Saturday for us, really, and we hope we can have you in the coming Saturdays as well. So just some updates on our end, really. I'll quickly share this and then run through. So as always, next week we'll have another session as well. So please do keep it a date with us. We'll have another topic to present to you, and great presenter, great facilitator as well. So please do look forward to that. We hope to see you as well. Then a couple other things as well, really. So as always, we have our Healthy Hearts program every Tuesday, focused on diet and nutrition, really. I mean, we had Dr. Ogie and Dr. Ayo touch on some of those things, really. Nutrition is very important, especially in the winter season, really. So please do make sure you tune into this. That's Tuesday. It's around food toxins and food safety. So please do make sure you tune in to listen. So that's by 6:30 p.m. on Tuesday. So please do make sure you attend that. And then we'll be having this year for the first time a brilliant event. So it's going to be a Caribbean African community carol service in Manchester Cathedral. So all the brilliant work that has been done by lots of Black-led and Black-serving organizations over the year, we would like to crown this up with a carol service. So there'll be lots of beautiful singing from various Black majority churches, choirs, and all that. So as we go into the winter season, what a great way to kick things off, really, with a carol celebration. So please do make sure you make it a day with us. It's on the 4th of September at the Manchester Cathedral by 7 p.m. And then also another event that is coming up as well, really. So overcoming diabetes inequalities. This is down in London. The tickets are available, really. So some of these are information sessions where you get to know more about different conditions and different things that are happening. So please do make sure you register to attend that as well. And then also we've got a workshop for children as well, really, on the 30th of November. So please do register for this, and then get your kids as well to come along. There'll be lots of learnings for kids on building their confidence, really. CAN's Advocacy Service is the one leading on it, to our community empowerment and advocacy team, really. So trying to get into our children earlier on, really, and empowering them, really, that they have enough information that they need. So not just health-wise as well, but then we know how the wider social determinants, so things like housing and all those are important to people's health. So please do make sure you sign up for that, really. And then this is another session that we will be pulling together, really. So it's around repatriation. I mean, we know, yes, as people are getting older, our loved ones, some would need to move back home and all those bits really. So you're just thinking around what support is available, and how we can help people to better arrange for some of those processes really. Maybe there is a loved one that has passed on, and then what is the whole process behind transporting and all that really, and what support is in place. So it's a session just to inform on some of those things. So please do tune into that. It's going to be online as well. It's on the 6th of December. So most of these, they're available. I mean, you can, I know my colleague is putting the links and all that on how to register for them in the chat box. So please do make sure you sign up to as many as you can. I mean, we roll out all this is really to the benefit of our community members. So you yourselves really are well informed really. And as always, we've been advertising this for a while now. So Leeds Trinity University, they're a really strong university here, really, and they have a nursing program that is currently targeted at adults, really. They are keen on getting people from our community signed up into that. So if you know anyone who is thinking of getting into nursing, this is a good opportunity as well. So please do keep an eye out for that, really. And as always, just to say a massive thanks to all the partners for the program, really, week in, week out, they labor to get yourselves on the call. So just to say massive thanks to all our CAN partners. So starting with Enfield Caribbean Association, Rafa International Development Agency in Birmingham, the Royal Assembly Redeemed Christian Church of God in Sheffield, Croydon BME Forum, and the Black Health Initiative in Leeds. So massive thanks to all the CATI partners as well, really, for pulling this together every Saturday. So for myself, it's just to say thank you for joining us. It's been a brilliant Saturday once again, and we look forward to seeing yourselves next week. So best wishes. Bye for now.
Well, our partners are incredibly pleased to handle being by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.